have this. Okay, great. So tonight we are fortunate enough to have Dr. Josie Van Londen, and she's been a wonderful speaker during our COVID presentations over the last, year and a half now. We've had Dr. Van Londen here. I guess this is probably our third time having her as a speaker. And so just a little bit about Dr. Van Londen. Other than being a super great person, she is a medical oncologist and a geriatrician at UPMC Hillman Cancer Center. She is the director of the Women's Cancer LiveWell Survivorship Center at UPMC Magee Women's Hospital and the director of the Cancer LiveWell Survivorship Program at UPMC Hillman Cancer Center. Her research interests focus on a wide variety of topics relevant to survivors via multiple collaborations, but her particular interest relates to the assessment and management of adverse effects of adjuvant endocrine therapy in older cancer survivors. She's board certified in internal medicine, medical oncology, and geriatric medicine. She received a medical degree at the University of Utrecht in the Netherlands. She completed a residency in internal medicine at UPMC and fellowships in hematology and oncology and geriatric medicine at the University of Pittsburgh School of Medicine. She's a member of professional organizations such as the American Society of Clinical Oncology, International Society of Geriatric Oncology, and the American Geriatric Society. So we are thrilled to have her here tonight, and I'm going to make her the spotlight so that she can give us some information. And how we're going to run this tonight is that she's going to talk about 3 different topics, and we're going to have you all we're going to ask you to ask some questions in the chat so that I can actually help, feel that she's also going to field some of those questions in the chat. And we'll do it by section. So we'll let her present, and then we'll have the questions then after her presentation for that particular section. And then we'll have her present again and have those questions again, and then one more time. All right. So we're going to go and do this. So I'm going to make her our spotlight. And there she is. So welcome, Dr. Van Londen.
Thank you, Wendy. The next time we're going to make the introduction a little shorter.
That's okay. You're worth that introduction.
Thank you. How is everybody tonight? I see a lot of familiar faces. So this topic is very rapidly evolving again. And so a lot of things that I was able to put together for you for tonight actually came out over the last few days, and some information is not even final, but I will try to help you shed some light on this so that you may better understand what you will hear in the news or read in your emails coming in. So one of the first things that I talk a lot about with my patients is checking whether there is a need to measure your circulating antibodies in your blood, whether there's a need to draw a blood sample to see how many antibodies you have circulating in your blood. That was the first thing I thought maybe I should talk about. The second topic that I thought we could talk about is this third booster that's popping up everywhere now. And I thought maybe the third topic we could talk about is this, it's confusing, but they call this new treatment, the treatment with monoclonal antibodies. Those are antibodies that this time will be administered as a treatment to help you fight the virus, if that makes sense. And so I thought these 3 topics are evolving very quickly. And so let's start with the first one, which in my opinion is one of the most mind-boggling topics ever. Do you need to measure whether you have antibodies against COVID in response to a COVID infection you've had and or a COVID immunization? And if so, when? And what does it mean? Is this topic helpful for all of you, or all of you know? Okay, fine. I find it the most confusing topic ever. And the whole week this week when I was in clinic, almost every one of my patients I discussed this topic with. And I honestly have more questions than answers. So I'm trying to keep it simple. So if you lose me, or I lose you, I guess, just stick up your hand and then we'll we'll rewind a little bit. But for most antibodies that you have accumulated in your body against any type of organism, whether it's a bacteria or a virus, for example, we can measure a titer that will tell us you have so many, I don't know, milligrams per deciliter of antibodies or proteins, really, in your body circulating that will tell us whether you have enough or not enough, because we know for those antibodies what the threshold is, above which you have immunity, under which you're not having enough antibodies to fight an infection if you would bump into one. So an example for that is varicella, for example, chickenpox, any other of those viruses, pneumonia. Some people don't mount enough antibodies against the pneumonia shot. And we know very precisely there what the threshold is, above which you have enough immunity and under which you don't. Now with COVID, we don't yet. And so most places where you go and you get your COVID titer checked, what they really do is make it a binary yes or no outcome. They don't tell you how much antibodies you have, but they tell you have them or you don't. But they don't tell you how much. So if you have them, you could have just a little bit or a lot. And if you don't have them, doesn't necessarily mean you don't have them. They're just under the threshold of detection. The other confusing thing is that our bodies are very smart. So once you've been immunized or once you've been sick with a certain organism, our body makes a lot of antibodies to respond to that immunization or to respond to that organism you were exposed to. But once that is out of your system, your body stops making those antibodies. Because why would it make that? It's just redundant. But you keep the memory cells. And if you would ever be re-exposed to an organism against which you have those memory cells, those memory cells would get themselves revved up and make very quickly a lot of antibodies to protect you. But where I'm going with this is, if you don't have a lot of antibodies, that's not necessarily a bad thing, depending on when you measure them. If you measure them a few months after you've been through all this hoopla, then your body may have quieted down the production of a certain antibody and just holds on to memory cells. And so the fact that your antibody levels are low does not mean you don't have immunity. And the other way around, if your antibody levels are high, still doesn't mean that these antibodies actually work. So having said that, does it help to do a blood test to see if you have COVID antibodies? It might, but sometimes it may raise more questions than answers. Now, very interestingly, what I discovered is that some laboratories, and in particular what I figured out, I think, Quest, does do this somewhat more quantitative measurement of your COVID antibodies. It starts to get to apparently more of a an amount of how much you have rather than yes, you have them or no, you don't. And so I've never had a patient draw that. So I guess soon I will get that first result in my inbox and I'll see how that looks like. But it starts to come around. But I don't believe UPMC laboratories do that yet. I don't know for Allegheny, but Quest I noticed started doing it. You just have to be very careful as a provider that you order the right tests. But I have no idea if you go to Quest if they actually do that or they automatically revert it back to that yes or no test, if that makes sense. Okay, so that was a lot of more questions than answers type of situation. I thought I should start with this particular topic because sometimes I use antibody testing to help an individual decide whether or not they need to get a third booster shot. And so maybe that's the next topic we can talk about. Does anybody have any questions this far about what I said about antibody testing? That was a very confusing story, wasn't it?
So there's a question, Dr. Van Linden, is that a T-cell test?
Very good question. No, it's literally just looking at antibodies, the proteins produced by B cells. Correct. It does not look at, very good question. It does not look at how functional your immune system is in responding to COVID. It just literally looks at how many antibodies you have, not how functional they are. Okay, hold on. Denise asks something. Can we look at? No, very good questions, but no. Can we look at total protein or platelet count to see if we should get the third vaccination? No. At some point, maybe yes, but I'm not sure they will ever, to tell you the truth. Platelet count doesn't really help us understand. The platelet count helps your body to prevent bleeding, or if you have a bleeding, it tries to stop that bleeding. Total protein is a little too vague. Total protein encapsulates all the proteins in your body, whether it's antibodies or any other protein in your body. It's very non-specific measure. Does it matter whether you had a manufactured vaccination or the live one? In terms of antibody testing, I'm guessing, no.
There's another question said, even if we get a result from Quest, we still don't know the immunity threshold. So I guess they're just verifying what you said, that, you know, if they get the result from Quest, that they won't know that immunity threshold.
The test you get through UPMC is a yes or a no. The test through Quest does the same thing unless your provider specifically checks off that you want this quantification. And then it looks like Quest should be able to do it and tell you how many antibodies you have. But I'm still not sure that for COVID, we know yet where the threshold is, above which you have enough antibodies and below which you don't. It's a very new organism. Okay. And so up until a week ago, how do I say that? When we started to talk about boosters and we didn't really have guidelines yet.
Okay, I'll be in a minute.
Oops. Please.
So with some of my patients, we had a compromise in which we decided, okay, maybe why don't we do a blood test that will probably take a week or two before you've done it and before we have the results. In the meantime, the guidelines might be out there, and then we can see based on that whether or not you, the patient in front of me, would need a booster. And so that's how I have been doing it, sort of to try to personalize what the recommendations are for each patient. But now in the meantime, the recommendations have come out for who should get this third booster, for those who are immunocompromised. And so I can read you those criteria, and you can see for yourself whether or not you fit into those criteria. And if you do, where you can go to get your third shot. They don't base this on your antibody test at all, unless you're over 65, which I will read to you in a minute. The confusing thing on top of everything else is that late last night, I don't know how many of you got these news flashes, that it says that everybody probably needs a boost. Yeah, so that's probably right. The question is when, and the question is how. And so some organizations seem to say that maybe, I don't know, 8 months or so after you've had your initial COVID shots, maybe then you should get a booster. I think all of you, most of you, I think, got your shots probably in the spring, right? So you're still within the first few months. Martin says no. When did you get your shot, Martin?
My first one was in January, middle of January.
So you were very early. So you're in that 8 month period. So it's all very messy. It's all very confusing. I don't think anybody knows for sure that 8 months is really when everybody should get a booster. Also very confusing. Nobody asks you anything. So if you go in for your third shot, nobody needs a medical letter. Nobody needs to prove that you're an immunocompromised person and you deserve to get your third shot. Everybody can go and get one, which is just more confusing and makes it probably somewhat of a scramble situation again. But at the same time, many of you are probably wondering, do I really need it? I didn't feel so well with my first two. Does it mean my third one I'm going to be even more sick? And many of us are hoping, including myself, that at some point, hopefully maybe, they will come out with a real booster. What I mean with that is that you're not getting the same shot as you had before, but that you're getting a completely different shot, which incorporates all these mutations that are floating around and maybe anticipate some of the mutations that are happening, so that it's a true booster rather than a repeat of the same one you've had before. But when this modified booster is coming out, nobody knows yet. We know some companies are working on it. They're trying really hard. Some people are saying maybe this fall you're going to get a combined flu and COVID shot in one. I'm not sure that is going to happen. But at the same time, things are changing so quickly, nobody really knows. But I don't think that's going to happen in the next month. And so I think right now and right here, I think we just need to make the decisions based on what is best for us. And I know some of you who saw me talk on Saturday, I kind of told you that maybe I'm not going to take the third shot. But then based on when I read these criteria, I'm like, well, maybe I should. And so I will read these criteria to you, and then let's see how many of you think, based on these criteria, that you would qualify to get a third shot. So here are the criteria to see if you qualify for the third dose. One category is those people who had a transplant, either a solid organ transplant with a heart or a lung or a liver, or those who had a bone marrow or a stem cell transplant within the last 100 days, or those who have something called chronic graft versus host disease. That can happen when you had a transplant and the cells from the other person are attacking your own body. And if you're on immunosuppressing medications for that. That is one category that would qualify you to get your third shot. Another category is your immune system, more in general. If you have an autoimmune disease or a chronic inflammatory disease, and you're taking a medicine to decrease the immune response. For example, you have rheumatoid arthritis or ulcerative colitis or Crohn's disease or lupus, and you're on medications like steroids or anything to dampen your own body's response to yourself. If you've received specialized immunotherapy in the last 90 days, which is that new therapy called CAR T therapy, CAR-T, you would know if you've had it. If this doesn't ring a bell, then I think you luckily didn't need to go through that. If you have low white blood cell counts on your own for no good reason, if you don't have a spleen, those are the immune criteria that qualify you, if not maybe urge you to go and get your third shot. Okay, next is medications that affect your immune system. If you take any medications that affect your immune response, and then they give a ton of examples. Is this helpful if I read this to you? We're halfway now. Okay, so examples of medications. If I take daily prednisone, if you take methotrexate, if you take Cellcept or Myfortic, if you take something that I don't even know what it is, Arava, A-R-A-V-A, Arava. If you take Imuran, I think if you're on these, you would know what they are. If they don't ring a bell, then just be happy you don't need to be on them. Orentia, Actemra, cyclophosphamide, cyclosporin, tacrolimus. Then there's a whole bunch of stuff that you get in a lab, like sort of through an infusion. It's anti-TNF treatments. They all end on either MAP, like M-A-B, or CEPT, C-E-P-T. That's it. Rituximab. More medications that all end on MAP or NIP, M-A-B or N-I-B. Unpronounceable, so I hope you won't make me pronounce them for you. Okay, so that's the list of medications. Basically anything that suppresses your immune system so it doesn't attack you yourself. Then there is a cancer heading. If you have active leukemia, either acute or chronic, if you have a type of bone marrow disorder called myelodysplasia or myelodysplastic syndrome, abbreviated as MDS, if you currently receive chemotherapy for cancer, then there is a heading for chronic illnesses. If you have chronic kidney disease, independent of whether you're on dialysis or not, but if you're on dialysis, that will be another point. If you have HIV, or if you have an immunodeficiency with which you were born, which you would know about if you have that. That means you would have frequent infections for which you're seeing an immunologist who may help you replace some of your immune functions. Now there is one based on age. That's a little complicated. If you're age 65 and over and you need help with your activities of daily living, so you need help with bathing, dressing yourself, going through your daily life. I know there's a bunch of questions coming in. I'll check them in a minute. Then if you're age 65 and over and you had your COVID antibody levels tested and you didn't have them. You know how they say it's positive or negative, but you didn't have enough, like they were not there. If that is the case with you, then that would prompt you, hopefully, to go and get your third shot. Do I make sense with what I just said?
Yes.
Now, another question I get, or I ask myself, is, okay, if we decide somebody needs the third shot, which one? Some organizations, including UPMC, seems to indicate you stick to the same one. So most of us had Pfizer or Moderna, I guess. Most of us had the messenger RNA. They suggest that if you stick with the same one. So if you had Pfizer for the first two, you get the third Pfizer too. If you have Moderna for the first two, you get it for the third two. However, there's some research going on to see if you mix it up, if that would boost your immunity more. We're not totally sure if that's the case, because in all reality, they've been kind of created off the same genome. All these companies were given the same viral genome, so there should not really be a difference, but there's some theory, and then probably UPMC is gonna throw tomato at me, but there is some little inkling of evidence that says that maybe Moderna provides a little better protection against the Delta variant, whatever that means. So if and when you feel you would like to get your third shot, you can do that without questions asked. You don't need a letter from your doctor. You can go tomorrow. Right now, there's no special booster. It's all the same stuff you've had before. Hopefully there will be a modified, updated booster, but I don't think that's going to happen in the next month, if not 2 months. But sit tight. Things are moving quickly. So if you get a shot, it's if you had Johnson & Johnson, they don't recommend you get a booster. The only one they say to get a booster for is if you had Moderna or if you had Pfizer. And then they recommend if you had Pfizer, your third one is Pfizer. If you had Moderna, your third shot is Moderna. Although there's a little potential more benefit of Moderna against the Delta variant. When you go and sign up, you can choose which one you want. So it's up to you what to do. It's like a Chinese menu, basically. So if and when you want to do that, I think you can go to, I don't know if the Giant Eagle has it, but I know CVS or Rite Aid, I think they do. And you can also go for UPMC, at least. Obviously, I can't help myself, but that's, they send all this in our email boxes. So the website for you to sign up for the UPMC third booster is vaccine. So you want me to put it in the chat thingy so I don't misspell it? Okay, hold on a minute. Give me a second. I need to send it to everybody. Uno segundo. It is this. If you're good with computers, that should be a secure website once you go there. But there's also a phone number you can dial. You lose this after the Zoom gets this closed, so you may want to write it down before we close your Zoom. That is the phone number. Can everybody see it, or you want me to say it out loud? Okay.
Yep, I think we can see it.
This is not easy stuff, is it? I know. I'm trying to make it simple. Is this easy to follow, or am I way out there with what I'm saying? Oh, there's a bunch of questions.
Right.
Is it easy to follow, or are you would you like me to simplify it a little bit more? It's okay, Kathy? Okay.
I think that you have a couple questions, Dr. Van Lunden. The one from is in here. It says, is it okay to get the third booster in less than 8 months, starting treatment in mid-September? And if so, is there a waiting period after the shot before treatment should begin?
Yeah, that's a good question. Yes, because I think most of us who are immunocompromised are going to get it earlier than these 8 months. So yes, what they're suggesting, from what I read, there needs to be at least a month between your previous COVID shot and this one. As long as there's at least a month between, you can go and get the next one. Is there a waiting period after the shot? They say it takes about 2 weeks or so for your antibodies to build. It would be even nicer, I think, if you have a month. But here's the thing, I don't know which treatment you're going to get, but if you get, for example, chemotherapy, it takes 7 to 10 days before it suppresses your bone marrow. And so even if you take the shots 2 weeks before you start your chemo, then your bone marrow still has like 10 days after the chemo to keep on making antibodies. That makes sense? So I would say take a shot a month before chemo if you can't do that. Try at least 2 weeks before, so your bone marrow has another 10 days or so after you receive the chemotherapy to keep making antibodies, and you get the most bang out of that third shot. So a month after your last COVID shot, and hopefully at least 2 weeks before you get your chemotherapy.
Okay, and the other question is, does it matter which shot you got? I haven't heard about J&J, which I think you answered, having a booster. Also, if you got Pfizer or Moderna, do you need to get that particular booster? And I think you answered those, that question earlier. Are these criteria that you were reading, Dr. Van Lunden, available online for the public to read, or was that something just you as a physician had access to?
For discussion with patients, not to be shared. So no, but I do know, give me a second here, because I spent some time looking. The FDA has something somewhere. Hold on, I don't know if I can find it. FDA news release. I don't know if they have the criteria on there. Give me a second.
Okay.
No, not as specific as here. Not as specific as here. Do you want me to find this FDA article so you can read it yourself, but it's not as Chinese menu as, okay, hold on a second. You can keep reading the questions.
Okay, so on chemo, let me see, on chemo actively and myasthenia gravis now, at what week during chemo would you pursue a booster? And am I okay? LOL.
Are you okay? Okay, I can't do two things at the same time.
I was going to say that's weird.
Yeah.
Pretty challenging. You can always find it afterwards, Dr. Van Lunden, and I can forward it to everybody too.
As 1 week during chemo. Yeah, that's tricky, sweetie. I mean, everybody has a different chemo regimen. If you really, really need to, well, we kind of tend to, if somebody is, for example, on an every 3-week regimen, I don't know what your regimen is, but you get your chemo time point 0, then 10 days later or so is your dip, and then your bone marrow needs to recover another 10 days, and it's somewhat normal, and then we hit you again on week 3. And so if we really have to give you a shot, then what we tend to do is do that around the time you're due for your next chemotherapy agent, because then your white blood cells are on the way up and on the way down, but overall higher than in that middle point when they dip. Does that make sense?
Yes, I think it makes
Who
sense.
asked this question? Judy Mill. Oh, Judy, that's you there. Does that help, Judy?
Feel free to unmic, guys. You can unmute.
So you're saying the 3rd week is when I should have it done? 3rd week. Okay.
Yeah, 3rd week. 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 3 Yeah, but when this is becoming a little personal now, or is there a point when you anticipate being done, or are you on this chronically?
I've got 2 more sessions to go. So I've got about, let's see, 9 more weeks. Or about 8 more weeks.
So that's 2 months. So that will put us where, oh, that's tricky, isn't it?
Well, and I got mine in March, so I don't have my eight months up until November. So I was thinking to wait till after the last treatment.
That might be better, because then you get more bang, you get more response. Right now it's always a little bit dampened, but again, something is better than nothing.
Yeah, but I'm on steroids all the time for myasthenia, so I always am immunosuppressed too. So I just be careful.
I think you be careful, and I think
Yeah.
it's a little bit of soul searching. But if you had yours in March,
End of March, yeah.
yeah, maybe wait until you're done so you get most benefit out of it. I don't know how comfortable you feel. Maybe at that time, in 2 months from now, we're going to have a new booster for all of us here. I don't know. I think this is a soul search question. I don't think anybody can give you this answer.
Yeah, just curious what you medically thought about it. Yeah, I was also going to get a hip injection this 3rd week of after this one because I have a bad hip. And they told me I couldn't have the immune booster 7 days before, 7 days after that anyway. So that actually puts me at least another cycle away. So
You have a complicated situation going on.
I have a very complicated situation going.
Yes, okay. Sorry,
It's by the
Judy.
grace of God that I'm surviving, but it's okay. I'm good with that. So
Yes, and then you're still laughing.
yeah.
Another
I
question.
figure my luck is I'm probably a carrier anyway, and I'm probably giving it to other people. So I mean, I don't really worry about it. But I just was, but I'll do a booster if I need one. That's why I was asking. So
That's good.
I don't think there's a right answer for you, Judy. I think,
it's all good. Thank
Yeah.
you very much.
Okay.
Another question. Are AI inhibitors considered chemotherapy for cancer? Okay.
No, they don't interact, modify, dampen your immune response. No. Okay, that's a good one. How do you go about getting tested for antibodies? So you need a script for that. So you have to ask one of your providers. Anybody can order that. It's a little complicated to find. They don't make it easy for us to find, but the order is in there. If you go to Upmc lab, for example, there's only that test right now that is indicating plus or minus. You have them or you don't. If you go to Quest, then your provider, at least that's what my understanding is, working with our computer system, then there is a special test we can order for you to take to Quest, and they actually quantify how many antibodies you have. That's a relatively new thing. I didn't see that before. You can join Quest and order your own. Oh, really? And order your own antibody. They did not do the extensive one.
Yes, I did.
Oh, really?
Yeah, I did it back. My pulmonologist thought I actually already had COVID at one point. So he had me run an antibody test 7 months later, and it showed up just no. So, but I did order my own, and he didn't put in a script for it. But there was no quantities.
No. Did it cost you anything?
Oh yeah, it cost a lot. It was $100 and some to have it done.
Yeah, you should be able to get it covered through your insurance one way or the other. I would suggest all of you ask your doctor, though. You shouldn't have to pay for it, sweetie.
I just did it to get it over with, but yeah.
You're very proactive.
Because I didn't do a prescription. I think it says on there, if you do it on your own without a script, then you do have an insurance problem. So yeah.
I haven't run into that yet. I haven't had any denials yet, or people telling me, what are you doing? This is not covered.
Well, I didn't submit it for insurance. According to their paperwork, I could order it, but unless I had a doctor order it, I couldn't run it through. So, but that's been a year ago or whatever. It's been a while ago.
Things are changing. Yeah.
Yeah. Okay. Bye.
Bye, Judy. And Megan says, I'm starting proton radiation, then doing chemotherapy. So that's like, I don't know when you're starting that. Who is Megan here?
Hi. Yeah. So,
Oh,
like I
there,
already,
yeah.
yeah, I mentioned, I was the one question that asked about the time frame and all. So I have a brain tumor and I'm starting proton radiation at first, and I'm still debating about the two different types of chemotherapy. So Timidar will be concurrently with radiation. So that is like you mentioned about like the, your bone marrow and everything. But if I am doing PCV instead, I do that after radiation is complete. So that won't be till probably say November or December, roughly, because I'll be starting in mid-September, the radiation at least. So does it matter like if I am doing the PCV, which again won't start till later in this year, can I still get my third booster before radiation begins just so I'm clear to go and have it, or should I wait?
When are you starting?
I'm sorry?
Sorry, when are you starting radiation, Megan? This is very,
Probably like, well, I'm getting my mapping done on the 26th, so next Thursday, and it takes about 2 weeks to get that complete for radiation. So it'll more than likely be say like September 13th, I will start radiation.
so then I will get it now.
Yeah, okay. That's why I wanted to make sure, just so it's good to go.
But Judy, you're okay, Megan. You can ask. And then Judy, it says here if you're currently receiving chemotherapy for cancer, you should get your third boost. But in your case, you're almost done. You're almost there. Nobody can make this decision for you. But in your specific case, I'm wondering, the pros and cons of maybe if you wait a little bit, you get a better response. But who am I? So I guess all these criteria have to be taken with somewhat of a common sense degree.
So somebody asked, will a modified booster have to go through clinical trials?
Yeah, probably. Although shorter. I at some point I read something from Pfizer that they were requesting an accelerated process because they've been through this process already, and all they're doing is tweaking just a little bit of the genomic sequence. And so they were hoping for this to be accelerated. And I guess whether or not it will be accelerated will determine when we will all get this, when this modified booster will ever see the day of the light. That makes sense? It's a good question, Gary and Dave. And then Denise found, you think that's the thing I have here? Probably. My title is different, but I'm guessing it gives you some information, and there's probably links in that. So the third week, okay. Martha says, how long does chemo kill cells, or how long should you be off chemo before you get the booster? How do I know if I need to get the original 2 shots? How do I know if I need to get the original 2 shots since chemo may have killed? Oh, that's an interesting question. So the official answer to that first question, how long you need to be off chemotherapy before you should get a shot. The official answer is for most immunizations, 3 months. But again, I'm not sure you really want to wait that long with this. Yeah, so I think we're all kind of winging it with this particular situation. This is like somewhat of an urgent situation. It's not like we're giving a shot for tetanus or something that's not really around. This is somewhat of an urgent situation. So I would say if you feel pressed to get it sooner than 3 months, which I guess everybody on this call feels, your blood counts should be pretty normal 2 to 4 weeks after your last chemo cycle. Maybe not totally normal, and maybe they're not totally functional, but something is better than nothing.
So
What if,
yes,
yeah, go ahead.
Susanna asked, what if you did it at the 10-day dip?
Yeah. most of the time we do it somewhere around when you start your new next cycle 3 weeks later. But that often translates into reality. It's like a few days before, because nobody's going to go on their chemo treatment to do their thing. So usually it's before you get your third week chemo dosing anyway. I wouldn't go exactly on the 10-day dip, because you may have no or very little white blood cells. And they start to come up very quickly, right around the time you do for your next cycle. So usually somewhere in between day 14 and day 21, but closer to 21 than 14, if I make sense. That was Susanna. Erica asked, would you recommend getting the quantified antibody test or the functional T cell testing is not out yet for COVID. And that's more a sign of how your overall immunity works rather than it being COVID specific. So I would ask for the COVID antibody test. And depending on what your physician can order and or where you go, that can be a binary test, yes or no, or maybe somewhat more specific in terms of how many you really have in whatever it is, milligrams per deciliter. Martha says, thank you. I think we got it all, did we?
Yeah, I think so. I think that's it.
Hey,
Anybody else have any other questions in particular to the information that Dr. Van Londen has presented thus far? Okay, great questions, you all. Good, thoughtful questions.
Am I flipping anybody out here? Like, is anything here concerning, or like, I don't want anybody to have nightmares or something like this, because this can be pretty scary for some people.
Yeah, now's your time to ask questions. I know there's been so much anxiety around it, right? I think a couple more questions popped up, Dr. Van Londen. Do you know if vaccine boosters will be available in the cancer clinic during regular appointments?
No, and that's the truthful answer. I don't know. At some point, eventually, we had some COVID immunizations in our clinic, but that was a little delayed. With boosters, I don't know. Not every clinic probably does. I wouldn't hold your breath for that, but hopefully nobody is going to throw tomato or tell you PMC has said this. I wouldn't hold your breath. I would go through that formal route, like that website and that phone number I gave you, rather than wait for the cancer center. Don't tell anybody who said that, please. I know.
That'll be quietly on our YouTube channel.
Yeah. Sorry. But
Megan asked, can you get the booster and the influenza shot at the same time?
I honestly don't know the answer to that. I can look it up, maybe after the call, because that's going to take me some time. You're right. Some immunizations you cannot get at the same time. You should not get at the same time. And it's usually clearly described in the, that little paper with the mini letters that's included with every medication. I know that in the fall, they were trying to maybe give these two together. So probably, yes, you can get them together. But my gut feeling is, I don't know how many of you felt well, but I didn't really feel well with the two COVID shots. And so my gut feeling is that I probably want to separate them out. I guess I like to be tortured twice, but also so my white blood cells can focus on one shot at a time rather than have their attention, be split between two. I think I would personally probably split them up until I hear or see or learn something different. And so what I started to tell you last Saturday, I told the virtual group that I have on Saturday mornings that I probably am not going to take the third booster, But after all this information came out and I did some thinking, I'm like, well, maybe now I should actually, because I checked several of those boxes. So I think I probably should. But it took me a while, and I'm still not 100% decided. So all of this is soul searching. What do you feel comfortable with? What do you feel safe with? I don't think this modified booster will be here soon. I got my shots way early in this year, like January. So I'm quite a few months out. Everybody needs to make their own decisions based on their own comfort level. It's not an easy decision to make. If you're needing some help to think it through, talk with your doctor. If you feel that getting this COVID antibody tests, if that will help you make up your mind whether or not you think you would qualify for the third booster. It's a little bit of an unofficial way of going about it, but what's wrong with it? Again, you didn't hear this from me.
Yeah, and I think that's been the general consensus when I've been talking to clients is that, they feel that maybe if they got that test and it was, somewhat accurate, like you're saying, if they could see it quantifiable, that might make them feel better about making that choice of whether to get it or not get it, right? So if you would get this third shot, Dr. Van Londen, and that other booster is developed and comes out, you probably wouldn't be eligible for that. Would that be correct? Or we're not sure about that?
We're not sure about that. That's one of the factors that I was a little hesitant about.
Mm-hmm.
Like, am I going to do this? I'm trying to get this over to my computer. Can you still hear me?
Yes. Yes.
Can I hear you, Wendy?
Yeah. Can you hear me?
No. Okay.
Okay.
I don't hear you. Hold on.
Okay.
Do you hear me, Wendy?
I can hear you. Can you hear me now?
Okay. Hold on, because my ears think hold on.
Okay. Can you hear me? I can't hear you now.
Try it again, Wendy.
Okay. Can you hear me now?
What the? Oh, try it again. I got you.
Can you hear
Okay.
me? Okay. Testing.
I don't know. I think in all reality, yes. But again, probably a month in between.
Okay. Sounds
I
good.
think you should be able to get the modified shot, even if you got the third booster. But a month in between. I don't think that modified booster, if it comes, is going to be here before the end of September. My side effects were worse after the second vaccine, which included a rash. Would you expect that the third shot would have even a worse effect than the second one? I don't know the answer, because some people said that the first shot was worse than the second. Some people said the second was worse than the first. Some people had no issues with either. We have no data to say that if you do worse, meaning if you have more side effects, are you gonna have more immunity? Meaning, did you build more antibodies? We don't know. So if you had a terrible rash, then I think, Renee, I don't see you, but I'm hoping you can hear me. That would be maybe a situation in which you would talk with your primary care doctor and weigh the pros and the cons. Somebody who hopefully maybe has seen your rash and can help you think this through, because certain rashes are okay. Other rashes indicate that maybe you have some allergic situation going on. And so I would discuss that with your primary care doctor. And maybe if you save the picture on your phone, you can share that picture so they can help decide if you're one of those who had that rash. And some of my patients who feel uncomfortable, who have some weird allergies in their history that were or were not what we call anaphylactic, which is a big contraindication to getting the COVID shots. If you're in the Pittsburgh area, which I think most, if not all of you are, then I tend to send them to a really nice immunologist who can talk it through with you and even give you the shot in the office under supervision. If you want that name and number, I can give it to you. I have no stock in this person's clinic. I don't get any benefit out of this, but I know some of you are preferring to talk with somebody beyond your PCP to talk about the pros and the cons. So let me know if you need that number. You would like that number, says Keith. Okay. Is that something that you would, Wendy, can I send that to you and you send it to everybody so
Yep.
they can?
That would
I
be
don't-
great. Yep, go ahead. You can send it to me and then, you can email it to me even when you have it at some point, and I'll disseminate it to these guys too. If anybody's interested in that, please email me and then I'll send it to you all. Cause most of you should be on my email list, but there may be some of you that got the link from somebody else. So if you want that, I'll put my email in the chat here too. So that you
Okay.
can reach out to me and then Dr. Van Linden, you can send it to me. How does that sound?
That sounds good. I have to tell you, Wendy, there was something else I was supposed to look up that I forgot now. Oh, the flu and the corona, the COVID vaccination, if they could be given at the same time.
Yeah.
I'll look that up.
Okay. That sounds
I-
good.
I know we're at the hour now, right?
Yeah, we're at the hour. I know it, any other questions? I know that you wanted to mention about the the monoclonal antibodies.
That's very simple. I can
Okay.
mention that in 30 seconds
Okay.
because it's so hot off the press that we really know very little about it. The only thing I'm going to tell you is two things. If you happen to have COVID as a virus, you're sick of it, which now this current variant seems to present with start with simple upper respiratory symptoms. So you think I have a cold or allergies, just be on the alert that it could perhaps be COVID. If you get tested and you turn out to have COVID and your symptoms are mild, I would check with your PCP and ask if you, based on your history, qualify to get monoclonal antibodies that help you fight the virus so that you don't get a worse version of COVID. So you nip it. And that's all done in the outpatient setting, not with an infusion, but with an injection. They do keep you there for a few hours afterwards to make sure your blood pressure, heart, no allergic reactions. I think you're stuck there for like 4 or 5 hours. I don't know what the protocol is. I didn't read it. But you don't stay overnight. It's just an outpatient procedure. And if you tell your PCP and if that person thinks you're at risk for advancing to severe COVID or whatever the criteria are at that point when you call, and the two of you decide you want to get these antibodies, then it will go from there. He will tell you where to go, he or she. Now, to make it go a step further, these monoclonal antibodies have now also been approved by the FDA emergently for emergent use in those who were exposed to somebody with COVID, but don't have COVID themselves yet. So if somebody tells you, oh, by the way, we hung out yesterday and now I have COVID, then I would call your PCP, explain how you were exposed, that person should hopefully know what your health history is. And then two of you can decide together whether or not you warrant to get these prophylactic monoclonal antibodies as an injection. Again, nothing in the hospital to stay overnight. It's go in, stay a few hours. If you don't have a PCP who knows what to do, I'm not sure what to do about the prophylactic part then. But if you're symptomatic from COVID, probably I shouldn't say this either, but you can go to the emergency room and they can give it to you there. Just maybe don't mention my name when you go there. Do that make sense? Now, I don't know, I guess the same on the Allegheny Health Network site, but all UPMC primary care doctors were educated on this. But if you have a PCP who's not affiliated with either of these, your situation might be different. They may not have access to this the way that you would like to. And so that's why I'm mentioning this other pathway. Is that helpful to all of you?
I think very helpful, gives them some tools for their toolbox in case they, they're exposed or that they get it, right? Which is important to know that you have options and you have hope,
Yes.
Any other
Thank you.
questions? You all have such great questions. These are great. Where can we get more information on the UPMC survivorship program? Do you want to take just a moment, Dr. Van Lunden, and let them know the value of what a great survivorship program is, useful to them?
Yeah, I'm not very good in tooting my own horn.
I know you're
That's
not,
okay.
but I'm going to do it for you, so.
Okay. Well, so let me get you the number because it changed again and I don't know it out of my head. So let me get that to you right here. I can get that in a jiffy. This is the number for Sharon, who does my scheduling. Right now, my clinic is only virtual because I'm not in person back yet. Hopefully at some point soon, but not yet. But most things survivorship wise, we can talk about virtually. And we talk about whatever it is. The visits are longer, usually 45 minutes for a follow-up, a little longer for a new patient. And so we have plenty of time to talk about what it is that's bothering you emotionally, physically, functionally. Sometimes we discover even other things that you didn't even know were bothering you, and that we can try to help you with. No judgment in this clinic. It's only me, myself, and I. So for sure you will be booked with me. You can bring anything to me and we'll deal with it. I'm not promising I can fix everything though. I don't have a magical wand, but most of the time we can do things to make it better, tolerable.
Right. Wonderful. So thank you very much, Dr. Van Lunden, for all of your knowledge and your time and your patience. And, we are very blessed in Pittsburgh to have you here for sure. And blessed to have you come on our Zoom meetings. And so we thank you all, everybody, for attending this evening. And if you have any other further questions, reach out, let us know. And we hope to see you, at every Wednesday at 5, we have these meetings. 2 times a month, they're general discussion chats. And then 2 times a month, we have speakers. We do have a cardiologist coming on in September to talk about heart health in terms of cancer care. So we're trying to cover all of our bases. So thanks again very much. And everybody have a nice evening.
Thank you.
Thank you.
Bye.
Bye.
Thank